Professionals Leadership Council is pleased to present part 2 of our series on how early career cardiologists can build a successful research career. Tonight, we are focusing on grant research and manuscript submissions. It's my pleasure to introduce our moderator tonight. He's an interventional cardiologist and associate professor at The Ohio State University. He specializes in coronary and structural heart disease. His research interests include structural heart disease, novel therapies, and valvular heart disease and heart failure. And now I welcome to our virtual stage, Dr. Scott Lilly.
All right, thank you very much. I'm happy to be here. Good evening, everyone. Welcome to part 2 of our webinar series. We're really glad you could join us tonight. We know that getting started on the research portion of your career may feel like a daunting and overwhelming undertaking, and we're here tonight to take some of the mystery out of this process for you. We're going to outline some of the basic terms, processes, and approaches that will hopefully set you up for success while you embark on your research path. We hope that you'll find the presentations tonight both beneficial, and maybe tonight will be the kickstart you need to begin your research journey. The objectives of tonight's webinar are that by the end of the presentations, you will all be familiar with the mysterious K&R grant application process and the arduous steps of manuscript preparation and submission. We'll go to the next slide in just a second. As you can see, the agenda this evening involves 3 presentations. First, we will have an introduction to federal and private funding. Then we will learn the nuts and bolts of manuscript preparation and submission. And then finally, we're going to discuss tips to become a prolific clinical research and academic productivity as an early career cardiologist. Go to the next slide. I have a few other physicians moderating with me tonight, so I would like to introduce you to my colleagues that have also joined me here on the virtual stage. First up, we have Dr. Erin Michos. She's the Director of Women's Cardiovascular Health and an Associate Professor of Medicine at Johns Hopkins School of Medicine. She has a number of research interests, including women and heart disease, vitamin D and cardiovascular health, preventative cardiology, and subclinical atherosclerosis imaging. Joining Erin and myself is Dr. Nadia Fida. She is Medical Director of both heart failure and cardiovascular imaging at Houston Methodist Baytown Weill Cornell Medical College. She's subspecialized in advanced heart failure and transplant cardiology and has research interests that include angiograms, heart valve disease, biopsies, heart failure, cardiac rehab, and of course, heart transplant. Additionally, tonight, we have what some may recognize as a new role in both live and virtual meetings these days. We have 2 social media moderators that will be taking our webinar highlights to the World Wide Web. I'm told if you would like to share your Twitter handle in the chat box, they might even tag you. So you can retweet it. I think that's a good thing. So keeping us relevant on social media tonight, we have Dr. Andrew McCullough. He's an Associate Director of the Graphics Laboratory and Assistant Professor of Medicine at Weill Cornell Medical College within the Division of Cardiology. And Dr. Özlem Baylan, who is an Assistant Professor at the Emory University of Medicine in Atlanta. She's with Emory Heart and Vascular and also a part of the Hypertrophic Cardiomyopathy Center. As a reminder, we encourage you to enter your questions into the chat box at any time during the webinar. When you think of something, go ahead and send it to us. We'll do our best to answer you tonight. Without further delay, I'm pleased to introduce our first speaker, who's here to give us an introduction to federal and private funding. He is the Patrick Lehan Chair in Cardiovascular Research and a Professor of Physiology and Biophysics. He's also the Chairman of the Department of Medicine at the University of Mississippi. Let's welcome Dr. Javed Butler. Dr. Butler, the stage is all yours. Oh, we'll have to unmute your microphone.
So one big question is that after doing 1,000 of these, if I still forget to unmute, I guess there is no hope. Okay, So absolute pleasure to be here. This thing is going to fly because there's a ton of things to talk about. So I did not even know where to start and where to end. So what I thought we would do is basically spend 10 minutes on definitions and a laundry list of options rather than going into any granular detail, but happy to answer questions as we go through the presentation. So one, when you start thinking about the grant and what kind of grant you need to apply for, there are a few things that we might want to think through. One is, what are the types of grants available and how do they match up with what I want to do? Second, it's not a one-time thing. Neither are you going to write one grant in your life, nor will that be the only opportunity to write a grant. So how do you keep yourself informed on an ongoing basis? What are the funding opportunities that are there? And then basically, what is the most relevant funding opportunity for you? So planning this and being a little bit ahead of the game is really important. Now, the choices are endless, and it can get really, really confusing. So one, there are many different places where you can get funding from NIH and Department of Defense and American Heart Association. And then if you pick one area, then there are multiple options there. So for an NIH, you have all of these different institutes, Cancer Institute, Heart Institute, Nursing Institute. And don't be fooled that just because you're a cardiologist that you can only apply to National Heart, Lung, and Blood Institute. There is a lot of other overlapping funding mechanisms whereby you can either apply to another institute or another institute can co-fund your research. So look at it a little bit open-minded. Then regardless of which institute you go to, then there are multiple types of grants that you can apply for. And some of these or most of these are investigator-initiated, but some of them, the topics are given to you to choose from. A few words on terminology. An early stage investigator is usually within 10 years, whereas a new investigator is somebody who may be at any point except that they don't have any major funding right now. So what are the grant mechanisms? Well, you have the different kinds of grant, and R and K and P, and what are the differences? I'll go over that in a minute. But first, let me just go over some basic mechanisms, and this is focused on the NIH grant. So the terminology is funding opportunity announcement. This is the overwhelming umbrella on which the announcements are made by the NIH of what kind of funding is available. It could be a program announcement. In program announcement, there is no funding line that the NIH has put forward or put aside. It's basically a program announcement that they are interested in, something, congenital heart disease, HFpEF, or something like that. Then you can either have an RFA or RFP, a request for applications or request for proposals. A request for application is a more narrow field that they are interested. So they can say, well, we're interested in machine learning and coronary artery disease or something like that. So now it's very well defined, and you actually then can apply and use your own ideas of what you want to apply for. Or it could be a request for proposal where basically they are not particularly interested in what you have to say. They have already figured out what research needs to be done, but then different people will apply for that grant and they'll choose based on which is the best application. So that's a little bit of a subtle difference between the two mechanisms. Within the NIH, so funding agency which is giving you the money, so that's NIH or PCORI or FDA or what have you. Institute is the basic institute within the NIH, whether it is the Cancer Institute or Heart Institute that is giving it to you. The person who is managing any particular funding mechanism is called the program officer. They are your friends. You would be amazed how much they try to go out of the way to help you. Please do get in touch with your program officer. But the intramural program officer, NIH staff, they do not review your grant. That is reviewed by your peers in a study section. So before you start thinking about where to apply, first a few questions. Obviously, what is the research question that you have? Any rough idea how much will it cost? Which stage of career I am in, and that will determine what you are eligible to apply for, and obviously which institute may be interested in giving me a grant. And a lot of time that you have to compromise, and the compromise could be in various different ways. Well, the idea is good, but it's going to cost me too much, and the funding line stops there. So maybe I need to do something now and something later and reduce my cost. Or I really want a Heart, Lung, and Blood Institute grant, but there is this nursing institute or cancer institute that has some funding. So if I just tweak my idea a little bit and have some additional things included or altered, then maybe I can apply to some other places as well. So it is a little bit of a sort of a give and take to optimize your funding that you can. So what are the different mechanisms available? You have individual research funding, so there could be multiple. Sort of the true north in individual research funding is an R01 grant, which is a full grant that you apply for your project. You can apply for smaller grants, so R03 would be much smaller, and then basically you can get some preliminary data, look at some databases and stuff like that. You can have an exploratory grant, an R21 mechanism, usually 2 years. There are others like R34, where you can develop preliminary data for a much larger grant subsequently. So there are all of these mechanisms. So the idea today is not to go into every single detailed mechanism, but just to highlight that you will need to spend some time on the NIH website to try to figure out what you're trying to do and what fits you best. Also remember that if you have an entrepreneurial spirit, that there are small business awards as well that you can partner with some federal funding. If you don't have a single project, but a bunch of your investigators are putting some things together, then it becomes a program grant, which are the P grants. So these are multiple projects, and maybe you're leading one project, and you're looking at, I don't know, cardiorenal syndrome, and one person is looking at imaging of it, and the other person is looking at biomarkers or something like that, and there are 2 or 3 R01 level separate projects. So those are the P grants or the program grants. Then you have the career development or training grant, which I think is the one which is most relevant to all of the people that are attending today, probably. These are usually not a lot of money to do research. You're supposed to be doing research with a mentor, but this is to support your time. But there are some research funds available as well. Usually it's for trainees or junior faculty. There are very few senior faculty options available, and they usually are have some other limitations. Like how far away from your training you are, and residency status, and some of those things. So again, there are many options in that. They are called K awards. It could be in basic science or clinical science, and there are all sorts of different awards. Some of them are at institutional level, some of them are training awards. So again, many options available. Just keep in mind that a lot of that is focused on protecting your time rather than doing research per se, but many of those have exceptions. You need to know how much will it cost, because there is a bar on how much they will fund you, and at the end of the day, your grant has to be within the budget. You cannot make promises that you cannot keep, because once the idea is liked, there is a test, a discussion done about the feasibility of the proposal being done. So where does the NIH put its money? This is a little bit dated, 2017, $34 billion. You can see that the intramural research is relatively small, but some of you may want to leave your universities and go and work for a lab within the NIH, and there is a pretty robust intramural program, but the vast majority is the extramural program, and the vast majority of that is independent funding from whatever your ideas are, rather than the specific ideas given by the NIH. I don't know what happened to this slide. So yeah, here we go. So these are the different areas. Cancer, neurosciences, infectious disease is up there, followed by cardiovascular. But I again want to emphasize that you can leverage. So you can do a cardio-onc research with the Cancer Center, or you can do a disease management with the Nursing Institute. Please do go to the NIH Funding Opportunity website, and then you can also put your name in the listserv so that you can keep getting these announcements. So please spend some time there. There are, as I said, business grants also. So you can have a business proposal and develop it with public funding as well for early ideas. Now I'm just going to go through the laundry list. So another place to look for is Department of Defense. They actually have pretty good funding line also. There are some small grants by the FDA also. They are mostly in regulatory science that you can look for. There is congressionally mandated areas of research also. So sometimes some high-level things that Congress is interested in, that they will put some money aside as well. Then are the big foundations. So definitely keep an eye on the foundation. So this is overall sort of all the different foundations and where they put their money in. And as you can see, there's about $1 and $5 of the foundation goes into medical research. So these are the top 10 foundations: Robert Wood Johnson, Kellogg, and Duke Endowment, Pew Charitable Trust. So again, tons of endowment out there from these private organizations. Please look for research there. CDC has grant, Department of Health and Human Services has grants. They have a little bit of different tone. There are actually rich individuals who leave some of their money for different funds for research. You obviously have your parents and relatives. Corporations. So again, a lot of the pharmaceutical companies have corporations that fund medical research. So please look into that as well as other things like Gates Foundation and other philanthropic foundations as well. Obviously, American Cancer Society, American Heart Association, American Red Cross, all of these have pretty robust research programs as well. If you don't know this, you would be interested in knowing that American Heart Association is the largest funder of biomedical research in the US outside of federal funding. So this is my last slide. There is no way for you to know all this unless and until you take a good long weekend and spend a lot of time on a lot of different websites. But because the universities want to be competitive in this space, your university research will have a lot of information in their university web pages. Please do remember to sign up for a lot of listservs so that you can keep getting all this information on an ongoing basis. And at the end of the day, find a mentor locally that you can talk to on an ongoing basis. Sorry, I went really fast, but I just wanted to give a big scope of what are the opportunities.
All right, very, very good. Thank you, Javed. What a lot of information there. You're absolutely right. Now's a good time to remind everyone that this webinar is in fact being recorded. The ACC is going to share the audio recording as well as the slides on acc.org in the coming days. So everyone that registered for the webinar will receive an email when these materials are posted to acc.org. So, take a deep breath. Don't worry. If you miss some of those terms or abbreviations, they're going to be at your disposal here very shortly. We do have a few questions. First, one of the questions was, what are the potential funding sources that fellows can apply for pilot funding?
So American Heart Association would be one place that I would definitely go and look for. And the other is training grants, so the T32 grants and that your institution may have. Some of them you apply directly to whatever. So it may not be within your department, it may be some other department at the institution, but there is a lot of interdepartmental funds for these T32 grants that occur also. And then there are larger grants built in. So for instance, your institution may have a CTSA, and then the CTSA have a training development funds as well.
All right, very good. And another question before we move on. What NIH grants are available for non-citizens?
I don't think any. American Heart Association is the place to go. I don't think the NIH application is available. If you have green card, you don't have to be a citizen. If you have green card, you can apply, but I don't think you can apply if you don't have a green card.
All right, well, thank you very much. Up next, we will hear from Dr. Jeffrey Hsu on the nuts and bolts of manuscript preparation and submission. Dr. Hsu is an instructor at the David Geffen School of Medicine in UCLA and has interests in advanced heart failure and transplant. He's obviously within the division of cardiology at UCLA Health and the West LA VA Medical Center. Dr. Hsu, thank you for joining us. I'm looking forward to what you're able to teach us tonight.
Thank you, Dr. Lilly. And I've been given the challenge of having to follow the esteemed Dr. Butler. I'll do my best. But thank you to the ACC Early Career Committee for giving me this opportunity to speak to our community on manuscript submission. So my title of the talk is Nuts and Bolts of this process. 10 minutes is a really tough time to cover the wide topics that we can really touch on here, but I'll do my best to give you what's helped me in my own process of writing manuscripts, submitting them. I'm not saying it's the only way, but this is what I think can help provide a good frame of reference as you get started with writing manuscripts. I'm going to start off by talking about manuscript preparation, and here's a brief outline of it. The important thing is to go into this process with a game plan, to be intentional about it. If you haven't written manuscripts before, it can be a daunting process. I think of it as looking at a mountain that's in front of you that you know you need to climb, but haven't started it yet. I think you need to approach it with a game plan. If you've written manuscripts before, you've already been on the mountain, but I think you could always use tips as to how to get up the mountain. So here is a little framework for my own game plan for approaching manuscripts. I'll start off with the timeline. So my mentor, Linda Deemer at UCLA, when we were writing manuscripts early on, she would tell me that writing a manuscript or writing a grant is like digging a tunnel. I've never dug a tunnel before, but I imagine if you dug a tunnel, you have to put on your gloves, your cap, eye protection, mask, whole gear, and then you start digging the tunnel. And it takes time to get ready to do it and to do it itself. And if you get distracted, you have to get pulled out of the tunnel, take off all your gear, do the other task. And then if you want to start digging the tunnel again, you have to get all the gear back on. You should think of scientific writing in the same way. It's really hard to multitask with scientific writing. You should really allot enough time for yourself to spend on the writing. It's really something that's difficult to multitask. So I think knowing what mindset you should have going into the scientific writing process, whether it be for manuscripts or grants, I think is incredibly important. Also, when is the best time to start writing your manuscript? If you're involved in research and you know that the manuscript writing process is on the horizon, when should you start? My answer is to start right now. If you're doing the research, there's something you can start writing. Typically, you're doing experiments or doing some analyses. You should get in the process of starting to write up the methods you're using to do these experiments or analyses. They'll ultimately need to be in the manuscript anyway, and if you're actively working on them, that's a good time to get started. I think the important part about this process too is just to get you in the habit of writing. It's something that takes a while, but it's important to grease these gears. It takes a while for them to get greased and to get going, but the earlier you start, the better. In addition, as you're gathering data, you're collecting your data, you often are presenting this data to your mentors, to your research group in figure form. If you're doing so, now's a good time to organize your figures in a manner in which you may want to present them in your manuscript too. You can get feedback from your mentor and your research group along the way, but this is a great time to start preparing your figures. Lastly, references. You're reading the literature, getting familiar with it. It's a good time to start collecting them in an organized manner because you'll need to have this library of references to cite in your manuscript later. Now's a good time to start collecting this. So you can already get started with the manuscript writing process now as you're doing your research. And I already mentioned this next point of having to set aside time for research, for writing. Next, it's important to have a journal in mind or a list of journals in mind. These are your target journals. This is something that's very important for you to discuss with your mentor. To develop a list, and it's like your rank list, but have one that your dream journal that you'd love to get into, and then have other ones that may be backup options. I'm not going to lie and say that impact factor is not important. It will factor into the list that you make. But I think even more important is to make sure that your message, the content of your paper fits within the theme of the journal and the journal's mission. How can you find this out? Well, you can read the journal's mission on their website typically, but also read the journal itself. See if the story that you're telling in your manuscript fits in with the stories that are being told in the most recent issues of this journal. Additionally, it's very helpful to get a sense of the level of scientific writing, the quality that you're seeing in that journal, and strive to achieve that same quality, because you'll see the top tier journals adhere to a higher level of scientific writing quality. So it's the more you read it, the more likely you are to write in that same manner. And it's also helpful to know the format of that journal as you are preparing to format your own manuscript. The next topic is something I mentioned before. I mentioned this mainly because if you don't have a reference management software that you're using yet, now's the time to start. There are plenty out there. A lot of them are free, open source. I like Zotero, but I think the important thing is to choose one and start collecting the papers that you're reading, storing them in this software. Because when you're writing your manuscript, you'll need this library to refer to. Importantly, too, before you start writing your introduction or discussion, update this reference library. Make sure that you're up to date onto the recent publications relevant to your project. I say this because when you're writing, it will be important that you include citations and references to all the major pertinent papers in your own paper. And this is because the one that you leave out is the one that the peer reviewer is going to notice, most likely because they wrote that paper. So you want to make sure you're including all the relevant papers, and it's very helpful to review this with your mentor beforehand. Next is the order of attack. So again, back to the intentional mindset of approaching the manuscript writing process, is that we have the order in which we tend to read manuscripts, but this isn't necessarily the order that you need to write the manuscript. The order that I like to approach it is listed here. I mentioned why I like to start with the methods and results first, because I'm already working on that as I'm doing my experiments, doing the research. Special emphasis on figures. The figures themselves should honestly tell almost the entire story of your manuscript. And spend extra time, especially this day and age where things are disseminated on social media in tweets or just figure form. It's important to really focus on your figures and making sure that they alone almost comprehensively communicate the message of your manuscript. I follow this up by working on the intro and discussion, but the abstract and title I tend to work on last. I like writing the abstract after I have the whole manuscript written out already, and I summarize the key points of each section in the abstract to make sure my abstract really represents what I wrote in the manuscript well. In terms of the title in the abstract, again, this is all my personal preference, but the importance is that you have your own process and you're intentional about the way that you are approaching your manuscript. The introduction, Dr. Deemer, my mentor, she framed the introduction for me as a inverted triangle, where you start broad and then it gets narrower as you finish the introduction. But also, the introduction does not have to be a whole review paper. It can be straight forward and to the point. You start off with a paragraph where you give a brief introduction on the topic, narrow it down to a specific aspect that you're addressing in your paper in the second paragraph. And the third paragraph, you should really just get to the point of what you're addressing in your paper. And I'm just show an example of a recent JAK heart failure paper by Dr. Stephen Green, where I just looked up a recent JAK paper to see what the introductions look like, and it really was a 3-paragraph format. So read through the journals that you're interested in publishing in and just see how the introductions typically are presented in those papers, and it can be very helpful. For the discussion, it's the opposite. So it's an upright triangle where you start narrow, go back to your hypothesis, and tell the audience, tell your reader what your data told you, how your data answered the hypothesis. Then start to broaden your discussion into placing your results, your data into the context of the literature. Very important to acknowledge your study limitations. No project is perfect without limitations. It's important that you do have a paragraph where you discuss these limitations and the potential generalizability of your results, and then end it with a brief conclusion. Lastly, for this section with the preparation, with the title and the abstract. So I think of it where the title should be a tweet. Try to be specific and avoid vagueness in your title. The more appealing the title is, the more likely someone is going to be wanting to read it, to click on it if they see it on social media. So it's important to spend extra time to ensure that the title accurately represents your excitement for your project and what you address in your project. Additionally, the abstract is like the elevator pitch, where you talk about the clinical question that you are addressing in your project, but also you really explicitly say what you can conclude based on your data. Very important to avoid overstatements. Really just state what your data supports and potentially say how it fits into the general context of the literature. Style, this is all a personal preference thing, but I love this quote by the French philosopher Blaise Pascal: "Would have written a shorter letter, but I did not have the time." It takes a long time to be concise. It takes extra effort to be concise. And I think with scientific writing, the key is to keep it simple. I was trained as an engineer, and the engineering philosophy is to keep it simple, silly. But I think the same applies to scientific writing. You're not trying to impress anyone with your vocabulary or with long words. I think the beauty and challenge of scientific writing is trying to communicate a very complex concept simply and effectively to your reader, to your audience. So here are some ways you can do this, but again, don't attempt to be verbose. Like, really try to be as clear as possible, and it's easier said than done. Other tips are to be consistent in things like the pronouns you're using, the tense you're using. Everyone will have their own preference, but I think the important thing is to remain internally consistent within your own manuscript to make sure you're not flipping back and forth between tenses and points of view. And lastly, revise. Before you submit your manuscript, you should revise it dozens of times over yourself, with your mentors, and build a network of reviewers. These are lab mates, friends, colleagues who you can send your manuscripts to. You can read theirs and just get feedback from people outside of your own field to see if you've clearly and effectively communicated the message you're trying to communicate in your manuscript. And that's it for this preparation part. So now you're submitting your manuscript and you think that the hard part's over, but the fun is just beginning. And I'm going to credit Dr. Mikos with this meme. I saw it, I think, in one of her presentations. But you submit your manuscript, you're happy you submitted it, but again, you're just getting started because you're not there at the accepted stage yet. And by the time your manuscript's accepted, you're back in episode X of Star Wars. So this is the second half, third half, fourth half, fifth half of this journey is to get your manuscript from the submitted phase to the accepted phase. For the submission process, with the time I have left, just a few key points. Cover letters, in my opinion, I think that they can't really help you. All they can do is really hurt you. You have to write one, but the key thing is to avoid pitfalls, making sure that you address it to the right editor, that you have the right journal name mentioned in the letter, and just briefly describe your findings, your paper. But the key thing is just make sure that there are no errors in the cover letter. Proofread it several times over. Send it to your mentor to proofread as well. In terms of formatting, I kind of went over this already in the interest of time. Here, I'll just focus on the figures. can't emphasize enough how important figures are. Some journals, like the JACC journals, do require a central figure or a summary figure for your submission. I think that regardless if it's required or not, it's always very helpful to have a figure that kind of summarizes your story that you're presenting in the manuscript. I say this as I'm a social media editor for one of the large cardiology journals, and it's very helpful to have this to, again, communicate the message in our current mode of social media communication. But figures are incredibly important to invest the time in. And sorry, this is stuck. And lastly, the revision process. So once you get the letter from the editor after they've reviewed it, review this letter with your mentor. You may get just a flat out rejection, but oftentimes it may sound like a rejection, but they're giving you the opportunity to revise it and resubmit it. If they give you that opportunity, my advice is to take it, regardless of how long the reviewers' comments are and how many points they bring up. Because again, you've done so much of the completed so much of the battle already. I think you're much nearer to acceptance at this stage if they give you this opportunity. When you're responding to reviewers, be very respectful, but you don't have to be over the top with praise for the reviewers. But the key thing is to address every single point that the reviewers and editors mention, especially those that the editors bring up. If you do disagree with something, that's okay. But you need to clearly explain why you disagree with it, and then again support it with more evidence for why you disagree, and you want to keep things as is for that specific point. So lastly, acceptance. At some point, you will get to this point where you're accepted. You've dug the tunnel. You're all the way out on the other side, and there are few feelings that really compare to getting that letter saying that your manuscript's accepted. Celebrate it. Enjoy it, live in that moment, but the next tunnel is waiting to be dug, and that's the beauty of this process. And then, but it's an arduous process, as was mentioned earlier. But I think going into it with this intentional mindset can be incredibly helpful. So I think that's it. I want to thank my mentors and thank you again to the ACC for giving me this opportunity to help the early career community.
Thank you, Jeff. That was great information for the audience, and your slides may be the best of the night. That Tim Robbins picture crawling through the tunnel, that's not just research and writing, that's basically all of 2020, and I suspect we're going to see some reference to that again. Our final speaker tonight joins us from New York City. During his presentation, he's going to give us tips to become a prolific clinical research and academic as an earlier career cardiologist. He's with the Helmsley Center for Cardiac Electrophysiology and an assistant professor in the Department of Cardiovascular Medicine at Mount Sinai. Please join me in welcoming Dr. Mohit Turagam.
Okay, good evening, everybody, and I thank ACC for this opportunity to present on tips to become prolific in clinical research and academic productivity as an early career cardiologist. So I have no disclosures. So my understanding of research is I start off with my big five of regarding tips for being successful as a early career cardiologist. Is the understanding of research is Murphy's law basically says everything that can go wrong will go wrong, but Murphy's research law says everything that can go wrong will go wrong unless it's your hypothesis that's actually wrong, in which case there's nothing wrong with your data and you just have to start all over again. So that basically summarizes the journey of an early career cardiologist. who's trying to do research. It's an arduous process, as Jeff and Dr. Butler had mentioned. So the most important thing is to clarify your goals. Is what you want to do research as a fellow in training or as an early career cardiologist. Is do you want to contribute to science that makes you change clinical practice? Does research make you a better clinician? Or is this just peer pressure that you want to be involved in research and look good compared to your peers? But whatever the reason it is always important to have specific goals that are measurable, achievable, relevant, and time-bound. Because everyone has different goals based on their practice setup, their clinical responsibilities, and their institutional support. So you just can't compare yourself with other people around you, and you have to work with the environment that you live in. So the most important thing is start early. Obviously, this is a long, arduous process, as Jeff had suggested. It takes time to build a profile, and it takes several years to actually have enough publications, or at least build a certain respectable profile as an early career cardiologist. Typically, in my opinion, it takes at least 3 or 4 years before you actually develop a decent profile. And it's like the rich getting richer. Unfortunately, there is no easy way out of this. So to start off with, as an early career cardiologist, it's not that everyone lands up with a randomized controlled trial or a first-in-human clinical experience project. So it's important that you take it easy and start off with doing small things, which is starting off with the review article is not a bad idea, which is very easily accessible. You can review the data and make a publication out of this. And eventually you start working with people and things start to get better. And then at some point you will be invited to write a state-of-the-art article for some major journal, and eventually be a first author of a first-in-human clinical trial, or a randomized controlled trial, which at a high-profile journal. So the process is long, and it is important to take one step at a time. The most important thing is ask the right question when you get involved in clinical research. Is this novel? Is the idea feasible? Is this going to change clinical practice? And is this going to lay foundation for future research? And does it need funding? If yes, what is the source? And these are all very important questions that need to be answered before you actually hit the ground running. Because that will actually save you a lot of hassle, because every idea that you have is not necessarily going to translate into a paper, because you should have at least 10 different ideas where 2 or 3 would translate into a decent clinical project and eventually a publication in a high-profile journal. So it's not necessary that you always have a large number of patients and a lot of funding to create a high-impact publication. Is an interesting observation is all that matters. Even a study with this observational, a retrospective study with a few number of patients, say 100 to 200 patients, with a tight follow-up can eventually result in a publication in a high-impact English journal. And the important thing is to keep looking around and understanding and try to see what is interesting around you, because you never know what can actually pan out. Especially these days with COVID around you, there's several unanswered questions, with impact of cardiovascular complications with includes COVID-19. And there are a lot of questions that can still be answered with a small group of patients. So just keep your eyes and ears open, and because there's a lot out there that still needs to be done. So research is basically a team sport. It's impossible for you to do everything on your own. So collaborate, find as many people around you as possible. There are a lot of other early career members and fellows in training who are very interested and enthusiastic, and you never know what can work out. Find a mentor who shares the same ideas and goals as you are, or be a mentor for some of your fellows and residents, because they're always excited, and there are a lot of things that you can learn from them. Expand your network, fine-tune your research skills, especially with statistics. Learn some basic stats. That'll actually save you a lot of hassle, because there's several projects where you can start and you can do your basic statistic part, And at some point you realize that, this is not going to pan out, and then you can move on to the next one. Otherwise, if you're just waiting for someone to bail you out, then this is never going to move forward. Take appropriate risks and accept criticism, which is very important for any clinical research, and create databases. I think that's the single most important thing every early career cardiologist should be doing, either at your own institution or with a group of other people from other institutions. That's how databases are built, especially if you're looking at doing research on niche populations where randomized controlled trials cannot answer those questions. The only way you can do those is by creating databases. I'll show you a few examples of some of my papers that were done. Funding is the most important thing, and money is important, and try to figure out those sources. Dr. Butler has already given a very nice presentation of the various sources which are available, and so just look out for them. And finally, IRB is the most important thing. Try to make sure that it goes through the regulatory process. Otherwise, you can run into quite a bit of trouble later on. So these are some of the papers which were published by working and collaborating with other people from other institutions on niche populations which cannot be answered by large-scale randomized controlled trials. So just keep your eyes and ears open, collaborate with people, try to find other institutions that are willing to participate in research, and eventually things will pan out. And funding opportunities, I won't go over these. Dr. Butler has already given an extensive presentation about the various opportunities which are available. Writing and submitting a manuscript is a key component, and Jeff has already gone over this in a lot of detail, but just to reiterate the fact that identify a journal where you think your manuscript can actually be published. Pick at least a top 3 of them, because it's not necessary that even though you do even though you have a great idea and it's done exclusively, it is not necessary it will get published into a high-profile journal, because it's all about timing at the end of the day. Remember, no delays. Others could be working on the same idea. Understand authorship guidelines. Give ample time for your co-authors and mentors. Submit on time. Mark your calendars at least a week or 2 ahead before the actual submission. And most importantly, do not plagiarize or falsify any data. And especially as an early career cardiologist, it's only going to be downhill from there. Get involved with various societies, especially professional societies such as ACC, the Fellow in Training Program, or the Early Career Council. Join committees, get involved in working groups where you have an opportunity to work with several other people and brainstorm ideas. And that's how opportunities come up, and that's how new ideas evolve. So finally, time management is the key, because especially as an early career cardiologist, you're very busy building up your own practice, and everyone has only 24 hours in a day. So unfortunately, time management has to be a very important aspect of how you juggle all these several things. Otherwise, you won't be getting anything going. So I would like to end with my boss, Dr. Fuster's quote from his paper from 2009, which is very apt for being a prolific researcher. Which basically means you should have a lot of passion towards your research. You should be able to take risks and understand reality. Be a team player and part of an organization. Be unbiased about your research project. Have no false expectations. Be approachable and friendly. And unfortunately, there are only 24 hours in the day, so intense work, mostly from nights and weekends, are the key. And accept criticism. So these are all essential to be a prolific researcher, especially as an early career cardiologist. So the last word, expect to fail. At first, everything is going to be difficult. Don't burn yourself out. So keep calm and research on. I'd like to end with that. Thank you.
Thank you, Dr. Turagam. It was a great hour. I learned a lot myself, and I'm sure the attendees did as well. We have a few minutes here for panel discussion and questions. One of the questions that came up during the course of the evening was what to do about statistics. Is this something that you should undertake on your own to learn? Should you contract it out or find an interested collaborator? And if you do choose to take this on yourself, are there resources to learn at least simple statistics rather easily?
Yeah, it's great. If you don't have strong statistical skills, I certainly recommend collaborating with statisticians. They can be really your friends in everything from helping to help power your study and design your analyses. A lot of institutions are affiliated with statistical departments, and I know at least at my institution, fellows and faculty can have a certain number of hours that they're allotted to use to go work with statistical teams. We have this thing called the Bead Corps. If you have the opportunity, many fellowship trainings actually have time on a T32 or something to actually get a formal degree program, which I think is invaluable. During my cardiology fellowship, I got a master's degree in biostatistics, in epidemiology. And I think that's really, really helpful for anybody planning a future career in clinical investigation to really get formal training in biostats and epidemiology. Because even if you don't end up doing your own statistics later in life, if you outsource that out by budgeting statistical support in your grant, just having that background helps you, read papers more critically, being able to have conversations, to help guide your statistician, help guide the analyses. So I really think that that's a foundation to get some additional training. And when you're writing your K award, we didn't get to talk about K awards that much, but that is certainly one of the goals that you could have is one of your career goals is to get more formal training. If that's a skill that you're lacking, that can be built into your career development plan, both as a fellow for the fellowship awards and also for a senior faculty award like a K award.
Very good. Dr. Butler, do you have some thoughts?
Yeah, if you're doing some retrospective analysis on a few charts, 100-patient study in your own institution, then I think trying to learn some basic statistics would be helpful. But if you're really doing a good project, a bigger project that you want to publish in a higher impact factor journal, you will need some professional help in order to be able to answer all the statistical questions that will come back from the reviewers. And I think some institutional help in terms of working with a statistician will be very helpful. But regardless, I completely agree with Dr. Nikos that the more you can learn either by reading or by YouTube or whatever the Google and the video resources that are out there, it is really not rocket science unless and until you start getting into some high-tech statistics. The basic statistics is actually pretty simple. So even if you work with a statistician, you will be able to get much more out of them in much smaller, shorter time frame. If, however, there is any opportunity to take some evening and weekend courses, that will also help. You don't have to do an MPH or MS. There are these short few week courses as well, and they're not that expensive either, and some of them may be totally free.
Very good. We have time for one additional question, and one of the questions that was raised tonight is whether or not, as an early career cardiologist, one should focus their efforts simply on papers that will result in first authorship, or if there's merit being second, third, or fifth on a manuscript.
I'll take a quick stab at that. I think that if it's your project, then you should be first author, but the more you can collaborate with other people, I think there's a lot of learning, even if you're second, third, fourth, fifth author. But if you're part of a team, there will still be learning about how to write a paper, what the statistics are, how to think about it. And you also form a team and a community that you're working with, and your efforts will also multiply. So you just want to make sure that you don't get sort of taken advantage of, that it's your project and somebody else becomes a first author. But beyond that, I would definitely take every opportunity to collaborate, and doesn't matter where you are on the authorship.
Yeah, I agree. me, I just want to mention though, if you're thinking about applying for a K award, so I get asked a lot, how many publications do you need before you apply for a K? And there's no set number, but typically at least 7 is good, at least 3 to 4 per year, and most of these should be in the first author. Like if you're going to try to seek NIH funding, that they you want to convince the funding agency that you're able to bring a project to fruition and provide evidence that you can disseminate your results effectively. You should probably have at least 7 first author papers, usually in the first 2 years that you're on faculty to show to show that you're meet the criteria to carry out the work. So that's the only caveat. I want to make sure if you're applying for a K. And then, just another note about the K though, plan way ahead of time, 12 months ahead of time, plan the big picture, gather up your mentoring team, consider 3 or 4 different research plans, plan a year in advance before you want to submit. And then 6 months ahead of time, start drafting sessions, 3 months ahead of time, line up your references, and at least 2 to 3 months before it's due, start getting feedback on your drafts. And really, you want to have like your budgets and everything finalized and your mental letters, 1 to 2 months ahead. So, sort of be thinking down the line of what your big picture is, and be planning. Some of these things take, more than a year in planning in advance.
Okay. All right. We have a couple minutes or a minute left. I wonder if Dr. Fida and Dr. Mikos would share their final thoughts and sort of take us home.
Yes, hi everyone. First of all, great webinar. I think a lot of information for the early career folks. There are a couple of questions here. I would agree with Dr. Butler and Dr. Mikos. I think whatever role you can get within authorship is very important learning. But it does not matter always to be a first author. You have to start somewhere. And sometimes there is this protection within the second authorship or a third authorship even, so you can learn and get feedback, and then lead on to be the first author. I think I wanted to touch, I had a question from Dr. Butler and maybe helpful to other earlier careers as well. When you apply for a grant as an early career investigator or as a new investigator, how does NIH weigh you in on that?
Sorry. What was the question? How does the NIH look at
when you apply as an early career or as a new investigator?
Yeah.
How does the NIH? How do they score in their sheet if you have not? Is it seen as does NIH has preference over developing that for as an early career person?
Yeah, no, it's really sort of a composite, because they will look at sort of everything, but you would be surprised that actually somewhat of a lesser weight is actually given to what your project is. So of course your project has to be good, but that's not where the most of the weight is. They are investing not necessarily in the project as an early investigator, but they're also investing in a person. So whether you have a track record and training to be able to do the project that you're doing, and then a lot also matters on the team and the environment. So your institution, your chief support letter, and your mentor, and whether the project you have the training to be able to do that. And if you don't have the training, is part of the application also includes training that will make you eligible and make you competent to be able to do your project. So again, it's much more than just the project itself. And in terms of your past productivity, again, I completely agree with Dr. Mikos. There is sort of no formula that you have to have 5 or 3 or 8 first author papers, but the more productive you have been in the past, obviously all of that adds up in their mindset.
Right. For the K Awards, there's 5 things we score on. I sit on the case study sections, and they're all equally important. So there's the candidate, that's you. There's the career development plan. there's the research plan, your mentors, and your mentoring plan, and the environment. So all 5 of those get scored. 1 to 9 or 1 to 3 are the high scores, and 4, 5, 6 are the middle, and 7, 8, 9 are the low. And so people got to get focused on their research plan, but that's only one of the 5 parts. And so it's very much important to also think about the mentoring plan and the career development plan and all the other components.
Can I chime in with one point about back to the authorship too? Very important before you really invest all this time in writing the manuscript, explicitly discuss this with your mentor, because in my opinion, the first author writes the manuscript. So if you're writing the manuscript, you should honestly get the credit and be first author. Sometimes you may assume it, but I encourage you to explicitly discuss this with the mentor so that you aren't surprised in the end when you don't get the first authorship. Unlikely scenario, but always better just to explicitly discuss this particular thing, because it ends up being important when, like Dr. Miko said, when you're getting evaluated for something like a K.
Right, I think the author order should be clear up front. I think that's the job of the mentor, the senior author, to really make all the roles clear and kind of stated up front who's going to be doing each part of the project and who's going to take the lead. And it helps alleviate any conflicts down the line. And, I just, again, summarize, about the paper. A well-presented paper makes all the big difference. You can have a really good project, but if it's not presented very well, it's going to tank. So really work on your writing. As was said, you don't need to be fancy or use long sentences, just be clear. You really want to have clear figures. Double and triple check your numbers. If the table numbers in the text doesn't match the numbers in the table, that's like a flag to the reviewers that they can't trust your work. It's helpful to somebody who's not on your project read your paper, as well as read your grant, to make sure they can follow it. Even if they're not affiliated with that area, that it should be really clear to anybody reading it. And then it was brought up about plagiarism, but what a lot of people forget is don't self-plagiarize either, because authenticate in these programs. And by that, it's sometimes papers, like in cohorts, the methods are kind of the same for the population, like for Mesa or Eric. Even though you might be using the same cohort, you can't copy and paste the method sections for that population from one paper to another, because even if it's from your own paper, it'll come up as a flag on Authenticate. So you have to write it new every time, even if you're using the same cohort that was recruited the same way. And really think about what a reviewer will criticize. And so if you can come up with your own limitations and address them kind of up front, then that will help take it away from the reviewer. If you can come up with your own limitations and think about what they might criticize and kind of state that, and make sure that both your papers and grants really emphasize the novelty and impact.
You can never make a bad paper good, but you can make a lot of good papers bad by not paying attention to these details. And remember, the reviewers also and the editors also have a human aspects to them. And when they see sort of 2 different fonts and 2 different sizes and, all that kind of stuff just sort of irritates. So just whatever it is, just make it beautiful. Make your figures, tables, pagination, formatting. That really, really helps.
All right, thank you all so much. Scott had to drop off, and it was a great discussion. Thank you to all our speakers, Dr. Butler, Dr. Shiv, and Dr. Turagam, and our panelists, Dr. Mike Mikos and Dr. Fida. Thank you, Kimmy and Kristen and Jacob, for helping us host this webinar tonight. And with that, I'll let Kimmy close it out.
And with that, we will conclude this evening's webinar. Today's program is copyright 2020 by the American College of Cardiology with all rights reserved. This concludes. Have a great night.
Bye.
Bye.
Thank you all. Be well.
Thank you, everyone.